you feeling overwhelmed, tearful, or just not yourself after giving birth? You are not alone, and in this video we're going to explore why that might be happening. I'm Dr. Brooke van der Molen. I'm an obstetrician as well as a mother of 3, and together we're going to look at an important topic for new parents, understanding the difference between the baby blues and postpartum depression. So in this video we're going to talk about what the baby blues are, how they differ from postpartum depression, and the key symptoms to look out for in yourself and where you can go to for support. This is not about diagnosing yourself, but rather about helping you to feel informed and empowered so that you can check in with your mental health after birth. This is also really important information if you are actually the partner or a family member of someone who has recently given birth. They may not spot the signs themselves, and you need to be the one to encourage them to get the help that they need. So let's get into it. Mental well-being matters. It is extremely important that women feel able to have an open and honest conversation about their mental health during the postpartum period. This is partly because adjusting to parenthood is hard, especially when you are sleep deprived, trying to manage your household tasks, looking after other children, and also trying to understand what your baby needs. But too often, people who've given birth, suffer in silence. UK statistics estimate that mental health conditions account for around 10% of deaths of new mothers in the UK in the 6 weeks after having a baby. Mental health conditions are also the leading cause of deaths among UK-based women between 6 weeks and a year following childbirth. It's not meant to scare you, it's meant to say this is important and we should talk about it. And the good news is that with prompt diagnosis and appropriate support and treatment, most new mothers with mental health difficulties make a full recovery. So, what are the baby blues? The baby blues are a very common phenomenon that usually begins in the week following childbirth and can last until a baby is 10 to 14 days old. Women with the baby blues can experience low mood, feelings of mild depression, and frequent episodes of tearfulness, just crying without any particular reason why, knowing that you should be happy in a particular moment but just not feeling that joy. Sometimes people feel really tearful just by looking at their baby because they're so happy, so they're just feeling like they want to cry a lot. It's believed that the baby blues is caused by sudden hormonal and chemical changes that occur after childbirth. As an example, estrogen levels fall more than 100-fold in the 3 days immediately following the baby's delivery. Baby blues is not the same as postnatal depression. So common symptoms of the baby blues include low mood, anxiety or restlessness, feeling irritable, touchy or grumpy, recurrent or sudden crying spells, including bursting into tears without any clear cause, feeling emotional and maybe overwhelmed. Now, whilst these symptoms might be distressing, particularly at a time when you likely expect to feel completely happy, they are totally normal. The baby blues are a normal part of the postpartum experience, and unfortunately there's no specific treatment available. People often notice that they start around day 3 to day 5, at that time when you're more sleep deprived because it's been a couple of days of you adjusting to your newborn baby. Your milk may have just come in, so you're feeling engorged and sore in the breast, and then suddenly you start to feel low and you're not feeling as happy as you expected to feel. Good news is for most new mothers, these symptoms are mild, they just pass in a few days. So some helpful tips to get you through include talking about your feelings with your partner or a close friend or family member, possibly writing down your feelings in a journal or a notebook. Ask those close to you to help with the tasks around the house if you can. So cleaning, cooking meals, gardening. It's not easy to ask for help, and not everyone has help available, I recognise that. But remember, this is a very temporary time and there's a massive upheaval in your life. So managing those day-to-day tasks on top of everything can feel overwhelming. If you don't have the help, just try not to worry about those things that are not immediately necessary. So if you need to live in a messy house for a few days, that's fine. It can be helpful to think about the tasks that can be outsourced for a few days or weeks to take some of that pressure off you, and consider if you've got the resources, for example, someone to help with the cleaning or getting a meal delivery or meal prep boxes, getting some extra childcare just for a temporary period for your other children. It can be helpful. So pause, take a few deep breaths. When you're feeling low or overwhelmed or tearful, hypnobirthing or mindfulness techniques can be a practical way to focus your thoughts. So have a look at some of the apps that you can download, like Calm or Headspace. So what's postpartum depression? Well, postpartum or postnatal depression is a type of depressive illness that develops after having a baby. The symptoms are similar to that of depression that develops outside of childbirth, so low mood being the most common complaint. Postpartum depression can impact on a new mother's ability to take care of herself and her baby. It can make those simple everyday tasks, like childcare, feel like a real struggle. And postpartum depression is common. It affects more than 1 in 10 women within a year of childbirth. And the symptoms usually develop within 2 to 8 weeks of birth, but they can develop up to a year after the birth of your baby. A smaller proportion of women have depressive symptoms, which can start during pregnancy and then continue after childbirth. So what's the cause? Well, there's rarely a single cause for postpartum depression. It can occur as a result of a combination of stresses and life circumstances in individuals who may already have a susceptibility to the condition. If she has had any of the following, so previous mental health difficulties like depression or anxiety during the pregnancy, having had a recent stressful or emotional life event like a bereavement, if you have poor social support from your partner or family or friends, if you have a marriage or relationship difficulties, if you've suffered domestic violence or previous abuse. Also, if you've arrived in a foreign country as an asylum seeker or a refugee. And then in a small number of cases, postpartum depression is linked to a chemical imbalance, such as low levels of vitamin B12 or having an underactive thyroid. So these can be easily screened for with blood tests and treated by your doctor if necessary. Now, it's important to remember that for many women, there are no clear causes or contributing factors to their postpartum depression. Also, having experienced one or more of those circumstances that I just listed above doesn't definitely mean that you will develop postpartum depression. So what are the symptoms? Well, women with postpartum depression can experience some or many of the following symptoms. Psychological symptoms include low mood, so feeling unhappy or tearful for some or most of the time, feeling irritable, hopeless or unable to cope, having a loss of interest in daily tasks or activities, including those that you previously enjoyed, having a poor memory or difficulty concentrating, or even just feeling unable to make any kind of decisions, having a loss of interest in sex, having intrusive or negative thoughts and perhaps feelings of guilt, having anxiety, which can also include panic attacks, withdrawing yourself from social contact with other people, including your friends and family, having a low self-confidence, experiencing mood swings, which can range from feeling agitated to apathetic. And of course, thoughts of self-harm and or suicide indicates a much more serious form of this condition. There are physical changes, so changes in your appetite, so a loss of appetite or comfort eating, having a lack of energy or feeling excessively tired, difficulty falling or staying asleep even when you are feeling exhausted, having some aches and pains, feeling generally just unwell or not yourself. And finally, it can also affect your relationship with your baby. So there can be a difficulty bonding with the baby, extreme anxiety about your baby, worrying that your baby is unwell or unsafe when they're perfectly fine, having a loss of interest in the baby, and that can include feeling apathetic towards your relationship with the baby, not being interested in taking care of the baby at all, having concerns also that you might harm your own baby either accidentally or intentionally. So as you can tell, there's a lot of overlap between the symptoms of baby blues and postpartum depression. So how do you know if you've got the baby blues or postpartum depression? Well, they do have a lot of symptoms in common, like the low mood, tearfulness, irritability. It can be difficult to tell the two apart, but generally your symptoms are more likely to be linked with postpartum depression if they are severe, if they last for longer than 2 weeks, if they do interfere with your ability to function, like eating and sleeping, if they interfere with your ability to bond with or take care of your baby. Now, the only person who can safely and appropriately diagnose your symptoms is a healthcare professional. If you think that you or your partner or your family member might have postpartum depression or any symptoms of concern, it's important that you raise that concern with a professional as soon as possible. That might be a health visitor, that might be your midwife, that might be your GP, or that might be by taking them to your triage or your maternity unit. So contact a healthcare professional promptly to arrange a consultation. Remember, it's normal to have a range of emotions after birth, and mental health is just as important as physical health. A lot of people worry that their baby's going to be taken away if they have signs of postpartum depression. Please be reassured that very rarely happens. It's common to experience these symptoms, and we'd rather help you and your baby in the comfort of your home. So if you've got any questions or you need more information, feel free to leave a comment below. And if you have unfortunately been through this yourself and you have any tips to share, also please leave them for others who might be going through the same. Do subscribe for more videos on navigating motherhood and health, but remember that you're not alone in this journey and there is support here for you.